All right, good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. We do work with autoimmune diseases for a lot of our patients. So tonight I'm going to start a new series called Infection and Autoimmunity. This is part 1. And tonight's video is primarily going to be focused on mouth bacteria and rheumatoid arthritis. So this relationship goes back many years. The first article I read about this was in 2009, at which time in an orthodontics journal or periodontal journal, these authors started talking about the association between a common bacteria seen with periodontal disease, referring to issues involving the mouth and gums, and rheumatoid arthritis. So that was rather interesting. Since that time, the main periodontal pathogen, Porphyromonas gingivalis, it's a mouth bacteria, has been found to have this specific enzyme called PAD, P-A-D. I think it refers to peptidylarginine deaminase. And this enzyme it's involved in the key biochemical reaction that we see with rheumatoid arthritis. And I'll talk about it here going forward. They did studies later on, and they found several periodontal bacteria in the joints of rheumatoid arthritis. To be specific, they found the DNA of these bacteria in the joints of rheumatoid arthritis patients, which is pretty interesting. What is DNA from bacteria in your mouth doing in your joints? And they did not see this DNA of bacteria in healthy controls. So now we know that this mouth bacteria, and they found Porphyromonas gingivalis DNA in the joints. So now we know that this bacteria, it's one of the unique bacteria, and that I think it's the only mouth bacteria, in fact, that has this peptidylarginine deaminase enzyme, which creates this what we call citrullination reaction, which is seen in rheumatoid arthritis. And now we're finding that this relationship with this mouth bacteria may have a significant effect on inducing rheumatoid arthritis. I hope that makes sense. So I'll just kind of go through the articles. This is from Experimental and Molecular Medicine, Host Microbiota Interactions in Rheumatoid Arthritis. They have a really nice diagram here just so you can kind of get an effect or get an idea of what I'm talking about. Certainly smoking has been seen to be a precipitating factor for RA. Hormones can be an effect, so can infection. And when we get down to the nitty-gritty of infection, it seems that gut bacteria, and I'll do a specific video on that. The Prevotella species are particularly important, Prevotella corpori. These other bacteria, as you can see there. And then also the periodontal bacteria, Porphyromonas gingivalis, and I believe this is another actinomyces type of bacteria. It seems that these periodontal bacteria particularly are involved in this anti-citrulinated peptide antibodies and the rheumatoid factor antibodies. This is important to you as the patient because if you present to your doctor and you're saying, I'm fatigued, I have this morning stiffness, particularly in my hands or my wrists, and it looks like my joints are swelling, your doctor is going to run a blood panel. And in that blood panel, they may check you for an anti-nuclear antibody, look to see if you have signs of lupus, but they're also going to test you for signs of rheumatoid arthritis. The RF factor, the rheumatoid factor, is actually not very definitive for rheumatoid arthritis. Certainly, most rheumatoid arthritis patients are going to test positive for the rheumatoid arthritis factor, but they have found that the CCP antibody, referring to, I believe, cyclic citrulinated peptide antibody, CCP antibody, is much more sensitive and specific for identifying who has rheumatoid arthritis. That's really important. And then even more interestingly is that they've seen in the literature this connection that the CCP antibodies actually show up before the disease process shows up. So CCP antibodies precede the onset of rheumatoid arthritis. So then we take another step back and we know, as I mentioned in the intro, that this bacteria, Porphyromonas gingivalis, has this key enzyme. It's one of the few, or if only, mouth bacteria that has this peptidylarginine deaminase enzyme, which is critically involved in the citrullination of certain peptides. And then we say, okay, well, this mouth bacteria can do that. Maybe this mouth bacteria, because rheumatoid arthritis patients have a higher prevalence of periodontal disease than the normal population, maybe this mouth bacteria is evoking an immune response here. But then, as I also mentioned, researchers have found Porphyromonas gingivalis DNA in the joints of rheumatoid arthritis patients. Pretty interesting. So here's an article from Pathogens, Porphyromonas gingivalis and its systemic impact, current status. Here they say many periodontal bacteria, particularly Porphyromonas gingivalis, were detected in synovial fluid, as I just mentioned, from patients with RA, at the DNA level. Autoantibodies against citrullinated proteins are confirmed to be one of its pathological bases. Porphyromonas gingivalis is the only microorganism known to express the PAD enzyme. Again, PAD is peptidylarginine deaminases. And then this was an article, I believe, Clinical and Microbiological Effects of Non-Surgical Periodontal Treatment in Individuals, with Rheumatoid Arthritis, a controlled clinical trial from Odontology, basically periodontal journal. Here they found that periodontal surgery in RA patients with periodontitis improved RA symptoms. Actually, it wasn't surgery, but they did this periodontal treatment to rheumatoid arthritis patients, and they saw the periodontitis improved. Basically, the treatment improved RA symptoms. All right. Now, this is kind of the most recent article. This is from 2021 out of the University of Leeds in the UK. There were also some other researchers from all over the planet. And this was a great article in that they're talking about the same relationship of an increased prevalence of periodontitis and perturbation of the oral microbiome has been identified in rheumatoid arthritis patients. And they're saying that this Porphyromonas gingivalis may cause local citrullination of proteins, potentially triggering anti-citrullinated protein antibody production. So again, the CCP antibodies, anti-citrullinated proteins or peptides, very similar, antibody production. And here they said the subgingival plaque was collected from healthy and diseased sites in 48 CCP positive at-risk individuals. So these are people who are at risk of developing rheumatoid arthritis. They have CCP antibodies, but they don't have rheumatoid arthritis yet. And then they compared it to 26 early rheumatoid arthritis patients and 32 asymptomatic healthy controls. And basically, the conclusion was that anti-CCP positive at-risk individuals have a dysbiotic subgingival microbiomes and increased abundance of Porphyromonas gingivalis compared to controls. They're saying this supports the hypothesis that the oral microbiome, and specifically Porphyromonas gingivalis, are important in RA initiation. So it's interesting that over the last 10 years, a little over 10 years, 12 years, that we've gone from the thought process of realizing that, hey, maybe this mouth bacteria might be initiating some sort of disease process in rheumatoid arthritis. A host of articles have been published since then. They found the DNA of Porphyromonas gingivalis in the joints of RA patients. We know that this bacteria has this specific enzyme to create CCP or citrullinated proteins, and we know that the specific immune response that we use to detect rheumatoid arthritis are antibodies to citrullinated proteins. Again, anti-CCP antibodies. So that's really, really important. And so if you know someone with RA, you may want to get them to a dentist or a periodontal specialist who works with cleaning up these lesions, because there is some evidence that that may even help disease symptoms. Am I against medications? No, I'm not. I'm just saying that a lot of patients who are looking for what's called functional rheumatology approaches are trying to change their diet. They're using fish oils. They're trying to do anything possible to make their body more healthy. And this may be a very targeted approach that can help individuals who have rheumatoid arthritis. In the next video, I'll talk more about gut bacteria and what that means to the RA patient, and I'll probably move on from there to urinary bacteria. I'll do an update on that, see if there's any new information on Proteus mirabilis, and I'll also talk about dietary strategies for rheumatoid arthritis. So I'm looking to go through all the autoimmune diseases this year, give you an update, and if you have any questions on specifics, send them to me, and I'll get back to you if I can. Okay, everyone, have a lovely Thursday evening, and I will talk to you soon.